Santanu Ray, working in Bhagirathi Hospital of Rotten Street. I work as a consultant pediatrician. Today we'll discuss about bronchiolitis in children. The incidence of bronchiolitis is very high in young kids, especially from the age of 6 months to 5 years. Normally below 2 years, we have found that the high incidence of admission for bronchiolitis and the mortality rate is very high below 2 years. So normally which kids get affected by the bronchiolitis? A mother who has been delivered by cesarean section has a high incidence. A mother who smoked during pregnancy may have a high incidence. A baby who was preterm, they can have a high incidence of bronchiolitis. There's a male preponderance. The male children are more affected than females. Especially the age, if affected early, they are really become serious. And what is the disease? Is it viral or bacterial? Is it a viral disease? The 50% of the main cause are by the RSV virus. The other virus can cause bronchiolitis like adenovirus, which really was disaster last year. They have affected a lot of kids last year and it a high mortality. There were other viruses like metapneumovirus, influenza virus, parainfluenza virus, rhinovirus, and etc. So I'm not going to details. So how a mother should know that my child is having a bronchiolitis? The first thing is that the respiration rate should be high. If the rate is high, the baby is panting for breaths, baby is vomiting, baby having mild fever, baby having cough and cold. Sometimes it might have a mild, like a running nose can be only the symptom of bronchiolitis. How long this symptom persists? It can persist for 5 to 7 days, even for 2 weeks. But the first 3 days is really a disaster. The mild symptom might get worsened and the distress might increase. So what the mother should do or the parent should do, they should keep a monitor and see the saturation. If saturation above 95, be happy, just relax. Just maintain the hydration, give fluids to the baby. But if you find that the hydration is not being proper, the baby is vomiting, baby can't take feed, then you need IV fluids, and for that thing you have to admit the child. Or saturation going down below 92%, that means baby hypoxic, so you have to give oxygen. Normally when the baby comes to the hospital, we give normal oxygen. If it doesn't improve with the normal oxygen, we have to give a high flow oxygen as a rescue therapy. So nowadays many kids come out with a high flow oxygen. What more other things we can do at home? We can give a nebulization of the child. How we do nebulize? By giving with an bronchodilators. Normally steroids have no role. We shouldn't give steroids for these kids. Sometimes ribavirin is a drug nowadays used in bronchiolitis, but still not in vogue in India. But many countries have started using this ribavirin. The only drug that might affect and create the RSV virus. And what other treatments we give? We give fluids, we maintain the hydration, and we maintain the child's saturation level above 95%. That's the main dictum of the treatment. And if the baby doesn't improve, then sometimes baby might need high flow oxygen or ventilator. That's a very rare chances. But sometimes the baby is after 5-7 days, baby having fever or again the symptoms recur, then there may be a chance of otitis media or some secondary infection, though rare, but might happen. So we should keep in mind that a secondary infection may happen, though rare. So might be a bacterial infection or some other infections, or baby having some congenital anomalies. Then the symptoms might aggravate in these kids. So in these kids, that admission might be a must. So how a mother should differentiate pneumonia, asthma, and bronchiolitis, and how the doctors should help them to guide that. The first thing is that in a pneumonia, the symptoms will be more, the toxic signs will be more, the fever will be very high, whereas the wheezing child, you can get a sound wheezing child, or tachypnea is more in case of bronchiolitis. The first episode of wheezing child is mainly a bronchiolitis, but if it is recurrent, then you have to take is an allergy or asthma of a child. So you should give a long-term inhalers in allergy or asthma. So the dictum is that just monitor the saturation, keep the baby hydrated, if required admit the child. This is enough for today. Thanks in a nutshell. Thank you.